Hey YouTube, what's going on? It's your host Antonio King, also known as King Scholar. Thank you for tuning into my YouTube channel. This is actually my first ever video. So I want to thank you for stopping by, thank you for watching, and hopefully you find this information very informative. So today's discussion is going to be on the coronavirus. I'm sure there's a lot in the media, a lot in the news discussing and highlighting the origin of the coronavirus, and I'm sure many people have questions about it. So today, I'm going to give you all the business in under 5 minutes, highlighting key factors, things I think you should know, and just a brief synopsis on this topic alone. So if you like what you hear, if this was very informative, do me a favor, just subscribe, hit the like button, and feel free to comment on anything or any questions for that matter you may have. Okay, let's dig right in. So, the coronavirus, what is it? Where did it come from? Okay, to answer that question, we're going to have to take you back to 2019, where physicians in Wuhan, China began to realize the emergence of a fairly severe respiratory infection, beginning with mild upper respiratory symptoms and gradually progressing to complications. Now, this infection was characterized by a high infectivity and a very high caseload. So many people were seen being infected. So because of its high infectivity and its impact on healthcare systems in China, this infection began to gain international notice. In fact, the virus that they identified that was causing these infections was actually part of the coronavirus family. Additionally, they noticed that this coronavirus aligned closely with the SARS virus that you noticed a few years back as well. So as a result, the virus has been named Severe Acute Respiratory Syndrome Coronavirus 2. So you most likely know the name of this virus, COVID-19, which pretty much stands for Coronavirus 2019. And again, it's been characterized by its high infectivity, its very high attack rate in the population, its potential progression to severe pneumonia, including acute respiratory distress syndrome, not to mention multi-organ dysfunction. So the initial COVID-19 virus began or originated in Wuhan, China, but rapidly spread to Korea and Japan, and subsequently then, and unfortunately now, to the rest of the world. So on March 11th, 2020, the World Health Organization declared COVID-19 a pandemic. So the clinical aspects of COVID-19 or the characteristics of this virus is, first of all, number one, high infectivity, a very high attack rate, very easy through respiratory droplets to be infected. However, the majority of cases, in fact, roughly I want to say a little over 80% of the cases, patients present with mild, non-severe symptoms. And this includes infections in children, young adults, and somewhat older adults. So unfortunately, those who are seen to be affected most by this infection are usually those over the age of 60, individuals who have compromised immune systems, also in those who have pre-existing medical conditions or comorbidities, including diabetes mellitus, kidney disease, heart conditions. Now, the mortality rate is estimated to be between 1 to 6%, but again, this is just an estimate. Now, unfortunately, because many individuals who have the infection, they present with mild or moderate symptoms, they're not being tested, so these numbers are somewhat skewed. However, if you were to compare statistically the numbers of individuals dying from influenza with those succumbing to COVID-19, it's actually estimated to be a tenfold higher, if not more. So furthermore, those who are mostly at risk and those who are succumbing to this virus are those usually over the age of 60 and those who are in unprotected, enclosed environment, such as nursing homes, detainment centers, cruise ships, things of that nature. So more interesting facts, the incubation period for COVID-19 is thought to be anywhere between 2 to 14 days. Also, seemingly enough, this virus can actually persist in its infectious state anywhere between 3 to 4 days on environmental surfaces. Now this includes tabletops, cups, spoons, doorknobs, phones, you name it. Now after the incubation period, most patients present with symptoms ranging from fever to dry cough, body aches, chills, diarrhea. I mean, these are influenza-like symptoms, so that's what makes it so hard to differentiate. However, they've noticed that shortness of breath has actually been a very common, consistent complaint in patients who've tested positive for COVID-19. Okay, diagnosis. How do we diagnose COVID-19? Now, unfortunately, COVID-19 can present simultaneously with other infections, so it's very important you want to rule out other causes. So testing for COVID-19 is usually done through nasal swabs and oral swabs to the laboratory, where they can confirm that through molecular testing. So the next question, how do we treat it? How do we treat COVID-19? So as of today, there's no confirmed standard treatment for COVID-19. There's no marketed medication or vaccine that can treat COVID-19. Usually the treatment of choice is supportive. Now, one key factor that's worth mentioning is that they've actually been seeing patients who have been getting progressively better, but they have a sudden relapse where they dip into a more severe complication because of the virus. So as of right now, I believe there's between 5 to 6 vaccines that's being tested to combat COVID-19. I believe it's being administered to live human volunteers in California. So we're very anxious to see the efficacy of this vaccine trial to see if this indeed works. So as of right now, the most effective way of curbing the spread of the COVID-19 is social distancing and quarantine. So this includes at least 6 feet of distance from each other, avoiding areas where you would gather in congregation, like concerts, parties, movies, things of that nature. And as you can see, we've actually taken steps to do so, where we're closing borders, we're closing restaurants, pubs, gyms. So guys, in conclusion, do your part. You want to wash your hands, you want to be safe out there. And I believe with enough cooperation and enough knowledge that we can definitely get through this pandemic. Okay, guys, thank you again for tuning in. Again, I'm your host, Antonio King Scholar. If you found this informative, please share the video and don't forget to subscribe. You can also hit the bell, the alert button, that'll pretty much tell you when I'll be posting new videos. And I'll be talking about different topics, ranging from diabetes to hypertension. If you have any questions or concerns or any topics you want me to touch on, feel free to drop a comment. Until next time.